Ever wondered what to do when your baby has a fever? It's a common concern for parents and caregivers, and not without reason. A fever can be a sign that your little one's body is fighting off an infection. But how should you respond? The first thing to remember is that fever in babies is typically defined as a rectal temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. Fever in itself is not an illness. It's a symptom, a sign that the body is doing its job and fighting off an infection. So, what should you do if your baby has a fever? Firstly, ensure your baby is comfortable. Remove any extra clothing, as it might cause their body temperature to rise even further. It's essential to keep the baby's room at a comfortable temperature, not too hot, not too cold. Secondly, offer plenty of fluids. Fever can lead to dehydration, which can make your little one feel even worse. If your baby is still breastfeeding or bottle feeding, continue with regular feedings. If they're older, offer water or an electrolyte solution. But how do you accurately measure your baby's temperature? The best tool for the job is a digital thermometer. For infants under 3 months old, rectal thermometers provide the most accurate readings. It might sound daunting, but it's a simple process that your pediatrician can guide you through. Now, when should you call the doctor? If your baby is under 3 months old and has a fever, reach out to your pediatrician promptly. Babies at this age have a less developed immune system, so a fever could indicate a serious infection. For babies older than 3 months, consult your pediatrician if the fever reaches 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. One important thing to remember: never give aspirin to a baby or child with a fever. Aspirin can increase the risk of a rare but serious condition called Reyes syndrome. In summary, if your baby has a fever, ensure they're comfortable, offer plenty of fluids, and measure their temperature accurately using a digital thermometer. Consult your pediatrician if your baby is under 3 months old and has a fever, or if they're older than 3 months and the fever reaches 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. And remember, never give aspirin to a baby or child with a fever. Remember, you're doing a great job and your baby is lucky to have you looking out for them. After all, a parent's love is the best medicine.